I'm just curious that whether, and that is a huge problem for these digital health startups, is getting that initial pilot, that initial win, access to real patients or physicians. And I'm curious if your kind of inside scoop working within a health system and how to navigate and how these organizations go about evaluating innovations, is that really useful to you on now on the other side of the table, of trying to break into organizations and have them use a thing?
Oh, it's extremely useful. I think thinking how, like I'm at an academic institution now, which is like which is
Hmm.
very different than being at a very business minded health system. It's an HMO like Kaiser Permanente. I think that they were like Kaiser Permanente, for example, is very forward thinking in the way they looked at startups, but they were very tough. If you're a little startup, they were really tough on evaluating companies and sitting there watching. I actually I was privileged to be able to attend a lot of work at Kaiser's Innovation Center in Oakland called the Garfield Center,
Okay.
and kind of work and get mentored by a lot of startups and go there on my days off. I mean, and just kind of do that work. And sometimes we would be like sitting in these Shark Tank like scenarios where we'd be looking at other startups and evaluating them and having like little pitch sessions. And you really had to be quite impressive to break in, and really had to
Hmm.
get to a certain level where you had some clinical validation. You were showing outcomes that were improved to really break into the bigger company. And it's kind of, at least at that time. And so it's really challenging. You're going to have to bring quite a lot to really break into a bigger organization and bring your evidence.
Right.
If you do find other groups, I'm not sure how graphite is functioning now, for example, that Kaiser Permanente is participating in, but if you can break in and get into kind of like design studio type or innovation studio type scenarios within certain healthcare companies, I mean they're going to be more kind of thoughtful or forgiving for your mistakes and let you do some of the work. I think that's an advantage, and there's people doing that work out there. There's more and more of that developing. But it's really hard to break in, and you got to bring some evidence. And sometimes it's better to start small and start pilots and other smaller practices, and not go for the way I kind of refer to KP as the white whale. It's like, no, don't.
Hmm.
You're in a rowboat. Don't go try to harpoon it's like, harpoon the whale. Start small and build your way up. And then when you
Yeah. Don't
when you
don't boil
build
the
that,
ocean.
then you
Boil
go
the
after the
water.
bigger
Yeah.
fish, right?
Yeah.
Because the white whale can destroy you.